Hi, everyone out there. It's Joan Kaler, your hostess for all things EFT tapping stories. And today is a special treat because today I have my friend and colleague, Dr. Kerri Husman. Now, let me just read you a few things. First of all, Dr. Husman is a board certified licensed psychiatrist in both Iowa and Colorado. Lucky you if you live in those two US states. But she is not your traditional psychiatrist. Trust me on that one. She is also, which is very exciting how I met her, president of the board of the Association for Comprehensive Energy Psychology, where I learned all my cool things about energy healing. Woohoo! So bear with me, folks, for just 1 second. Let me pull up her bio here. Dr. Husman brings a wealth of experience to Eastwind Healing Center. She aims to empower women, children, and the QTBIPOC individuals age 6 to 64 seeking care for anxiety, trauma, pain, and treatment-resistant conditions. Dr. Husman also works with ketamine and Spravato in the office, provides psychedelic-assisted therapy, and works with spiritual emergence and spiritual emergencies. While she collaborates with colleagues on more complex issues like eating disorders and primary psychotic disorders, her focus remains on therapy tools that connect deeply with the unconscious mind. Dr. Husman adopts a conservative prescribing style. Listen to this, y'all. Favoring cost-effective generic medications without compromising quality. She believes in starting low and preventing unnecessary polypharmacy, meaning prescribing a ton of pills and just juggling like a salad bowl of medications. For many of the disorders that she treats, she views medication as a tool for healing, not a lifelong burden, and has experience with compassionate deprescribing. In other words, helping people off their medications when they're no longer needed. In addition, her expertise in integrative psychiatry underscores her approach, and she integrates lifestyle components such as sleep, self-care, meditation, diet, movement, and spiritual connection into her treatments, providing a holistic pathway for those unable to tolerate or benefit from traditional medications. I told y'all that this is exciting. Was the last time you ever met a psychiatrist like that? Okay. Welcome in Dr. Kerri Jo Husman. It's great.
Thank you, Joan.
Thank you. This is so much fun. What is integrative psychiatry?
Well, Joan, that's a fantastic question. What I can tell you is if you asked 10 people who hang out that shingle saying, I'm an integrative psychiatrist, you'll probably get 10 different answers. And that's not all wrong or bad because it really depends on their training and experience. So for me, I mean, I'm certified in functional medicine. So I bring some of that education to my integrative practice, which is in the insurance model. That doesn't mean I do all the fancy schmancy tests for functional medicine because those aren't covered in the insurance model, right? But that doesn't mean I'm not checking labs on things that need to be checked and really trying to optimize things when people's ferritin is low, but it's normal in the normal range, but too low to sleep well. If you don't address that, they're going to keep having trouble sleeping. You can throw a kitchen sink at it and they're still going to have trouble sleeping. So just learning those really important things in functional medicine in the, you know, 2016, 17, 18, when I was going through all those courses, it was really valuable. But then adding in to integrative psychiatry, adding in all these trainings with energy psychology, all the trainings with hypnosis, breath work, and later psychedelics has really brought so many people relief who weren't getting relief before.
Oh boy, I wish you were in Pennsylvania. Oh slash well, I guess I'll have to move to Iowa or Colorado. Um, what is ferritin? Help me with that.
Ferritin is a marker for iron storage. So just
Ooh.
how much, so for example, if so people are familiar with hearing the words iron deficiency anemia.
Okay.
And so women of reproductive age who are having menses every month, who've had a baby, I mean, the odds of having iron deficiency anemia is not small. But the percentage of women who are not iron deficient but have low iron stores who are reproductive age is about 20%. So when the standard test of doing the finger prick for hematocrit or doing a blood draw for a CBC, it looks normal. And so they said, oh, well, it can't be your iron. If you don't check the ferritin, you don't know.
Okay, everybody out there, if you can't get sleep and you have low energy, ask your doctor for a test for a ferritin marker. Is that
Mhm,
what it? Okay.
mhm.
See, this is information that you only get from my podcast, folks, just to let you know. Wow. And you're certified in all those additional integrative methods, hypnosis and psychedelic-assisted counseling. So sadly, in Pennsylvania, there's a lot of that going on in eastern Pennsylvania around Philadelphia, but no one is doing that in Western Pennsylvania where I am. But for explain what that is. I mean, I know learning from you, but they don't
So
take LSD and go on a trip. This is completely
not not yet, but they used to.
okay.
So when Stan Groff was revolutionizing psychedelic therapies, this goes back to the 50s and 60s and continued until the mid 70s. And then the Nixon administration, basically saying all psychedelics have no medicinal value. They are not safe. They're as bad as heroin, essentially. And so they were all rescheduled to Schedule 1, which is a schedule that psychiatrists and other physicians cannot prescribe. But prior to that, they were using LSD to treat schizophrenia. Now, I'm not saying we should all go do that, but they were using it in pretty revolutionary ways and curing people. I mean, that's a four-letter word,
I
right? To say
know,
the word
yeah, in
cure,
mental
but
health
people having phenomenal outcomes.
terms.
And so nowadays it's a very different game. So with ketamine and Spravato, so ketamine has been approved as a dissociative anesthetic since 70, 71. I'm blanking on the exact date, but old school, right? Been around a long time. It has not been approved for any mental health condition. So it's off-label use for all of us who use it for treatment-resistant conditions, whether it be um, PTSD, depression, anorexia, alcoholism, narcotic abuse, whatever it may be,
Hmm.
it's all considered off-label use. Um, there are insurance companies that are starting to cover it. So as of 2025, IV ketamine is covered in Massachusetts for treatment-resistant depression. It's covered in Minnesota. I'm pretty sure Wisconsin just added it.
Hmm.
So my state's your state not covered, at least not yet.
Right.
So that's a great step. The VA is also covering it now, IV ketamine. I offer IM ketamine in the office because this is cash pay, and I can offer IM cheaper.
Hmm.
Same amount of drug, it's just given in a different way.
Hmm.
And so that's what's offered right now. Um, Preparation prior to that, integration after that, those are therapy codes. That's, the person is not ingesting the medicine, but that day where they come to the office to have the IM ketamine in the office, that appointment, which is can be 2 to 3 hours long and can be done in small group, again, reducing cost even further for the individual. That's done in office.
So you can not only administer it, but then
Do
how?
the therapy, yep, do the prep and integration and support that. Yep. I'm
Oh,
trained to do that as well.
oh wow.
Offering Spravato is a little different. So Spravato is covered by insurance, but for very specific indications. So Spravato is, well, ketamine is racemic ketamine. So the left-handed isomer, the right-handed isomer. Um, ketamine is the left-handed isomer only. So it's been remarketed as a new drug. With many medications, when they offer the active mirror image as a new drug, they are oftentimes reducing some of the side effect risks. And that is part of why Spravato was offered. Now, there's an argument for racemic ketamine as well because it has some of the longevity is in that R-ketamine molecule and its metabolites, which is a whole other conversation. But with Spravato, it is now approved for three FDA approved indications. One is treatment resistant depression. So you need to be severe depressed, have tried a variety of treatments, oftentimes combined treatments. So a mood stabilizer and an antidepressant plus cognitive behavioral therapy. So you have to have been through a few rounds of that for ketamine to be, or for Spravato to be approved for
Okay.
treatment resistant depression. That's one option. Option two is for major depression that is severe with suicidal ideation.
Hmm.
So a person is currently severely depressed and suicidal. That's another way to get Spravato covered. The third way, which is a newer indication just early the beginning of this year, so I think February it came out, is as monotherapy. So these other two, you have to be on psych meds because they've gotten you to a certain point,
Hmm. Okay.
right? You're not at the bottom of the barrel, but you're still severely depressed.
Uh-huh.
The third indication is that FDA approved is the use of Spravato as monotherapy after two failed trials.
Ooh.
You don't have to be on meds still. You just have to have had two trials. Probably you'll have to be severely depressed. But so far, I work with Blue Cross in Iowa. So far, Blue Cross has not adopted paperwork and requirements for approval for that third indication, but that is expected to come soon.
Okay. So if a patient wants to try that, obviously they need to check with their insurance company to see.
Yes, they'll need to have an assessment. They may
Right.
be, depending on the provider, they may require a referral to a treatment center that offers Spravato. The Spravato providers will then need to do their assessment and get all the information for the past trials of treatments, therapy, so individual therapy, group therapy, meds, combinations of meds, the dates, the outcome. So there's a bunch of information to obtain. It's not that onerous typically, though some people have been through 20 trials or more.
Mm.
And we provide all that information in the prior authorization process and typically get information back in the next few days. And then the medicine is ordered. The medicine's pretty expensive. So um, that's the bulk of the cost of the session is the cost of the medicine.
Wow.
You
I'm
know,
going to
so
go on some of my Facebook Pennsylvania online therapist and just inquire as to if anyone is doing this. I mean, psychiatrist.
mhm.
And I would love to become certified in assisting with psychotropic medications and therapy, but there's no sense me going all through that because I don't have anyone to prescribe it where I am in southwestern Pennsylvania. So once it comes here and I have somebody like within driving distance, not just Zoom, that I can collaborate with, then
And
that's
that would
possible.
ideally, yes, you'd like to have someone close by that you could collaborate with.
Right.
And there are a variety of ways. Ketamine is offered sometimes in people's homes. Again, it's not my place to say that's a good idea or a bad idea. There's
Hmm.
risk involved with everything, but I just offer it in the office because I'm continually monitoring them as if
Right.
they were taking
Well, I
Spravato.
would
So
never do ketamine, people. I would never do ketamine as a licensed professional counselor through Zoom. So don't get any ideas out there. But
so
strictly in my office in southwestern Pennsylvania. But that it's kind of a moot point right now because it's not offered that way in Pennsylvania. But this is for all the world. So we're talking about the United States right now because that's where Kerri and I are both licensed.
mhm.
So we are not educated on the rest of the world. So we can't speak about outside the United States, but this is what's going on right now inside. This is just so fascinating to learn all this Cool beans. Yeah.
Yeah, it when offering ketamine intramuscularly, one of the advantages to it is every emergency room doc, every EMT in this country has used it. So it's a very common technique. Let's say a child has a dislocated arm or, like they've dislocated their shoulder and
Mhm.
they're going to relocate that shoulder. And that's an uncomfortable experience. It's brief, but wow, you don't want to necessarily be fully with it when you have that experience.
Mhm.
And ketamine is how they're oftentimes treated. They give them a little bit of ketamine, they relocate the arm. Um, Ketamine is also used when someone is agitated. Now, again, that can be problematic if someone has
Mm. Yeah.
overestimated the size of the individual and given them too large of a dose, but it is effective, though it is dissociative. So someone's experience in their agitated state, if they're having to be restrained in some way, and that experience can be amplified by
Okay.
the ketamine.
Okay.
So a loud noise is louder, a
Mhm.
scary thing is scarier, if you're conscious and awake and aware. So,
So
yeah.
that's the
So pros
serious
and cons.
stuff.
Yep. Which
Yep.
is why having people experience any psychedelic really in a safe location with monitoring with by people who have expertise and have training.
Right. Come on,
Most train
Pennsylvania. Let's get rolling on this, please.
Well, every state, as you know, is looking at um, psychedelic use above and beyond federal regulations
Hmm.
in various ways. And every state has their own barriers to that as well.
We have Pennsylvania is a wide state. It's actually a commonwealth. So from Harrisburg, from the capital to the east, there are, I believe, many providers and therapists over there. But when you get to Harrisburg and west, it's like a deer in headlights. Nobody's doing that. So, but in time, hopefully before I'm gone the next 30 years, this will come to pass. But
Well,
that would be a
at,
nice option.
at some point, there are three. So as of right now, so July 25, there are three synthetic psilocybin derivatives available that aren't available. They're at level 3. So there's kind of 4 stages to get to fully approved by the FDA. So
Oh,
they're essentially one step away. Now, that last step can take a year or two, right? Sometimes longer. But
mhm.
there are 3 different companies that have synthetic psilocin. So psilocybin from magic mushrooms breaks down to psilocin, that's the active ingredient. And that alone is being studied for treatment-resistant depression and PTSD.
That would be wonderful. I
Mhm.
mean, we have energy healing. There's so many tools out there, folks. It's just not pop a pill and CBT and you're done. There are so many options available. CBT is wonderful. I don't want to ditch cognitive behavior therapy. That's not the message that I want to give. But that alone, because the conscious part of the brain is only 10%. All the choices that we make are from the subconscious part of the brain. So, and when you're doing hypnosis, that's in the theta part of the brain, which is the sleepy time right before you fall asleep, which is the moment of high suggestion and energy healing for all the different energy pathways of the human body. There are so many different ways to heal. That's why I tell all my clients and you who are watching and listening that if you don't have the relief that you deserve, or you've been in counseling forever and you're still not, you still have the same problems, the same issues, taking the same pills, you might want to investigate what I do and what Dr. Husman does, which is integrative medicine for Dr. Husman, integrative counseling for me. But going back to, I want to ask you about, you mentioned in your bio the spiritual aspect because you're also a shaman, aren't you?
So The language that we would use in the Foundation for Shamanic Studies is a shamanic practitioner.
Okay.
And the reason for that difference is I am not a part of a tribe, and I've not been designated as a part of a tribe with that sort of a title.
Okay.
So the folks with the Foundation for Shamanic Studies and working, just to be fully clear, working with one's soul is not psychotherapy according to your licensing board. It's not psychotherapy according to your malpractice insurance.
Right.
But do we support people on their spiritual journey? Absolutely. There are many ways to do that without doing soul retrieval, right? That's in my coaching and wellness practice. I have a separate practice where I do those things, and I do not treat the same folks in the same practices. So my psychiatric patients, I refer to trusted colleagues for coaching or for healing with energy medicine or for shamanic healing or shamanic instruction. The good thing is I have people to refer to for those things that I trust. And if I have a coaching and wellness client or student who needs psychiatric care, thankfully, I have people to refer to for that as well. So that's how we do it to really keep everything above board, crystal clear for everyone involved.
So your coaching practice, because it's not insurance based,
Hmm.
that go outside of Iowa and Colorado?
Yep, I do coaching all over.
Okay, folks, hear that? You do coaching all over. She does coaching all over. Okay, so the coaching practice, kind of like me, in that my consultations can be done all over the place, and they're definitely not insurance based. Maybe someday the counseling compact will go through for Pennsylvania, but until that time, no. Just licensed in Pennsylvania. Oh, but I do have a telehealth license in Florida, and I do have clients in Florida. So if you're from Florida, we can talk. Okay, having said that, it's one of the wonderful things that I've learned from the Association of Comprehensive Energy Psychology is number one, there's always hope. Two, there are always new methods being discovered, developed that are so helpful for the mind, body, and spirit of
Hmm.
every individual. Okay. It's so interesting to me because the art of counseling, I mean, psychologists didn't get licensed until the 70s. I don't think social workers got licensed until the 80s. And counselors, professional counselors, we were the last kid on the block. That didn't happen until 1998. But there are so many different possibilities. Folks, don't ever take in information if somebody says you have to deal with this or there is no, we don't use the four-letter word that begins with a C and ends with an E, but you can be, you can feel so much better than you do. So if you're not feeling as good as you would like to, there is hope, but you do have to search for somebody that meets your needs. Do not stay with a therapist just because you like them or you don't want to hurt their feelings. Okay? If you're not feeling as good as you would like to, it's time for a change because there are so many options available to you. Not just CBT and medicine. It just drives me nuts when I hear that that's all that's being offered in some clinics. Anyway, okay, Joan, let's get back on track here. What would you like the world to know, Dr. Husman, about integrative psychiatry or what you do? I want people to have, I'm going to have all your contact information. Okay, Joan, take a breath. How can people contact you?
So the easiest way is to um, reach out to either of my websites. They have a contact page. People can call my 800 number. Um, which is 866-425-8066, option 2. Um, and that goes to me. So I'm in the kind of a practice. So at Eastwind Healing Center, the healing center that I co-own, we have a variety of healers, massage therapists, acupuncture, functional medicine, integrative psychiatry. We have therapists who do all sorts of different psychotherapies, and we offer spiritual healing, emotional healing, different types of coaching. We have a lab, we have a supplement store, we have a lot of things.
Wow.
I'm very grateful. It's nice to be able to get some of my service needs for myself by walking 2 doors down or across the hall.
Yeah.
But, each of us are independent practices. So under our umbrella, we have, 15 different businesses. And so it ends up working out really well.
Uh, it
Yeah, I
sounds so
know. Most people
wonderful.
say, you have that in Iowa? Yes, we do. Yes, we do.
I'll tell you an interesting story. I hope it's interesting. Long time ago when the dinosaurs were on the earth, I went to see the movie Field of Dreams. It touched me so deeply that I cry every time I watch it. The end result, the message was ease his pain. And then
Mhm.
at the end, it was people will come,
Yeah.
people will come. And the long string of headlights at night leading to the baseball field. It went, I need to go back to school and become a therapist because people will come and I want to ease their pain.
Hmm.
And that went straight into my soul. And that's been my mission. That's what I came to Earth to do. So, are you anywhere near the Field of Dreams or?
Yep. I used to work in that. So during my 4 years at the National Health Service Corps, and this was after I graduated from fellowship in child psych. So I had 4 years that I spent putting about 50,000 miles a year on my car, going to all these different locations in Iowa, serving these various underserved counties. Um, one of the counties that I worked in was where the Field of Dreams is located. So, yes, very familiar, not that far away.
Wow, that is so neat. All right, ASAP, let's go to Ohio for our next conference. Geez, oh man. Iowa. No,
Well,
Ohio would be fine too, but
yeah, I've been working on it. I would love to have a conference in the Midwest, or just in the middle third of the country,
really, yeah,
but working on it.
that would be
I'm
fantastic.
not the only voice. I'm just the president. I'm not
Well,
the only
I
voice.
will go anywhere, you know that. What, okay, where am I going here? What is your website?
So I have three. So there is eastwindhealingcenter.com, and that gets you to the healing center, all the service providers, and links you to the other websites as well. My vitalitypsychiatry.net is my psychiatric
Okay.
website, and mammothhills.com is my coaching and wellness website.
Don't worry, folks. I'm going to have all this in the information, whether you're watching right now on YouTube or whether you're listening on your favorite podcast channel. All this information will be in there. Never fear, Joan is here. Okay. Is there anything else that you want the world to know?
Well, a couple of things that I have really enjoyed working with lately is functional neurologic disorders.
Mm,
And so these are situations where folks have pain, loss of function, discomfort, loss of strength. It can be a variety of things, and they can't find typically a medical cause. And these experiences for people can be absolutely devastating, making it difficult or impossible to take care of their kids, to be able to work, be able to drive a car. I mean, you name it, because sometimes it's seizures. And what's been so fun to do is use the three tools that I'm certified in that are for pain. So I use holographic memory resolution, which is Brent Baum's work. This is energy psychology at its one of the finest ways to deliver it, in my opinion. I am biased. I've reframed more than 600 of my own memories using it. So you
mm,
don't have to have tons of big T trauma to be able to really benefit from moving lots of little t's too.
Mhm.
So between that, with pain reprocessing, and then emotional awareness and expression therapy, so that's Howard Schupner's work. Those three tools, when I'm working with someone with functional neurologic disorders or just someone with chronic pain, the tools can be blended and utilized together, and tapping can be installed at any time if you choose to use that. So it has been just so much fun to do therapy sessions where people are able to move their body, to walk again, to take care of their kids, to get back to work, to not be stuck anymore.
Oh,
And this typically doesn't require any meds. And if we are using meds for a lot of these folks, it's minimal.
so amazing what's available.
Yeah,
So amazing. And you are amazing
thank
because
you.
you just take it in and give your love to the world for healing. You are such an incredible healer.
Thank you.
You can do it all. You do all. You don't have to search for anybody to prescribe because you can prescribe. So, wow. Folks, I told you this was going to be important, and it is. Kerri, thank you so much, Kerri, Dr. Husman. Thank you so much for doing this podcast with me to get the information out. That is why I do this podcast, because I want people to learn what is available for them. I want people to know all the new things, all the wisdom that EFT tapping, energy psychology, integrative healing, the whole ball of wax that's available to them. So
Wonderful. Well,
you,
thank you again for inviting me. It's been a pleasure, as always, to catch up with you, Joan.
oh
I
my
just love all
gosh,
the things you're doing too.
I try. Hold that thought. But everybody who's watching, listening, again, thank you so much for your time. If you find this valuable, please share with others. And I so appreciate if you would um, subscribe to my channel. Lots of good stuff coming ahead. Thank you all. Namaste.